schedule. Yep. Thank you so much for taking time out of your very busy schedule. First question. The City of Toronto has a drug and alcohol policy, much of which is administered by the Drug Secretariat within Public Health. Would I be right as characterizing the approach as we don't take a position on whether drugs and alcohol are good or bad? We acknowledge people are going to use them, but instead we try to reduce the harms from drug and alcohol use.
Through this, Councillor Perks, that is a good summary. All drugs have the potential to cause harm, including health harm. The idea is, how do we mitigate or minimize that to the greatest extent possible? Okay.
And next question, through the unit I just described and the Toronto Drug Strategy Implementation Task Force, we've launched a review of that overall program, and we've signaled alcohol policy as a key part of that review, correct?
Yes, through the chair, that's correct.
In 2019, the Centre for Addiction and Mental Health did a review of alcohol policy in Ontario, and they made a couple of findings. One of those findings was that alcohol is much more dangerous both to individuals in the community than many illegal substances, correct?
So through the speaker, that is correct. That is those were the findings of that report from the Centre for Addiction and Mental Health.
They also found that steps that have already been taken to increase access to alcohol, such as selling it in supermarkets, have resulted in increased harms in the City of Toronto. For example, more emergency visits. Is that correct?
So through the speaker, that is also correct. There's no question. There is a body of evidence that actually demonstrates that increased access to alcohol does indeed increase consumption, and increased consumption increases the likelihood of the harms associated with consumption of that drug, in this case, alcohol.
At the same time, Toronto Public Health and others have been calling for more investment in some of those mitigative measures you described, in terms of access to treatment and education in the schools. But those programs have not been forthcoming from the provincial government, have they?
So through the speaker, that is correct. And again, that position that we have taken along with the drug strategy is in keeping with the evidence that exists on the subject. That, look, if there are going to be these substances available, that reducing the harms or mitigating the harms associated with that is best achieved through, things like regulation that moderate consumption, and access to services, the necessary services that support people that run into troubles when it comes to consumption of those substances.
So, in considering a bylaw amendment which will increase access to alcohol, we will see increases in harms, both to the individual drinking, but also to the society at large. But we're going to be doing it in a policy environment where we don't have a concomitant investment in the tools that would mitigate those harms. Is that a fair summary?
So through the speaker, Councillor Perks, I think you're quite right. I think the evidence would suggest that, look, the more access there is to a substance like alcohol, the more consumption there is, and therefore the more harm, both to the consumer and to those around them. At this point in time, I don't know of new investments in respect of mitigating. That certainly is an option for this council to pursue, as well as other levels of government as well, in order to mitigate the risk and the harms that are associated with that substance and its use.
So in summary, allowing drinking somewhere isn't itself a good thing. It's the policy environment around it that matters. Is that a fair statement?
Through the speaker, I think that's fair, and it doesn't apply just to alcohol. I think that applies to a lot of other behaviors that we humans tend to engage in.
Thank you so much.
Thank you. Councillor